After being admitted at the hospital, patients have a lot to manage, but they're usually too sick or hurt to do it all. They need their caregiver to help. This video has information to help you prepare for a hospital stay. An important first step at the hospital is to get to know the nurses and let them know that you are the point of contact for the patient. Nurses are key sources of information and support and can answer many of your questions. Nurses can help you understand medical procedures and hospital processes. They can also provide practical tips for caregiving and tell you where to find more information. Also, if you are the substitute decision maker or your care recipient has given consent, ask to meet with the attending doctor and explain that you want to be kept informed of important tests and diagnostic results and included in all medical decisions. As a caregiver, your contact information should be in the patient's hospital record. If the substitute decision maker is different from the caregiver, it is important that the patient record includes contact information for both persons. For more information on substitute decision makers and power of attorney, see our other videos linked in the description box below. You will also want to ask for the best way to reach the doctor. You should keep a running list of questions and find out when the doctor will be visiting patients so that you can be there to get your questions answered. It also helps to write down the answers. If you don't understand what the doctor is saying, ask them to provide more explanation. It's okay to speak up. One of the things you may want to ask is, if this was your mom or dad or child, what would you do? Inviting the doctor to step into your shoes is a helpful method to gauge how you may wish to proceed. As a patient advocate, it is helpful to familiarize yourself with the patient rights, such as to be treated with dignity and respect and without discrimination, to receive information relating to any proposed treatment and options, and the right to second opinion. You may encounter situations when you will need to remind the healthcare team of the patient's rights. New medications can be part of the treatment in hospital. Patients with chronic or serious diseases usually take many prescribed medications, as well as an array of non-prescription items. Ask the nursing staff to tell the patient and you the name and purpose of medications given orally or through IV. Frequently, doctors at the hospital prescribe new medications and instruct the patient to stop taking previously prescribed drugs. Ask the doctor in hospital if you have questions or need clarification. Inform the family doctor or other specialists who have prescribed medication previously of the change in prescribed medication. They may have concerns and questions for the hospital doctor. Another important thing that needs to be discussed with the attending doctor is medication reconciliation. This is the process of comparing a previous list of medications with an updated one. It should occur whenever there is a change in medications, care settings, or diagnosis. Medication reconciliation is particularly important when a patient is discharged and is moved from one level of care to another or discharged from the hospital. As a caregiver, you can help with this process by keeping an up-to-date medication list, taking the list to all doctor's appointments, hospital stays, admission to a medical facility or nursing home, keeping the list updated any time a medication is added to or taken off the list, reminding the doctor or nurse about any known allergies or side effects the patient has experienced in the past with certain medications. Medications that shouldn't be given should be highlighted or bold-faced. You may ask for a copy of the list of medications upon discharge so you can give it to the family doctor. Sometimes the discharge notes may not reach your family doctor's office on time. Talk to the attending hospital doctor regarding the need of home care services so the doctor can put the request in the chart as part of the discharge plan. It's also helpful to meet with a hospital's social worker or case manager. They can provide information on coordinating care and local caregiving resources. They often help with discharge planning issues, such as follow-up care. This is your opportunity to restate the need for home care services for your care recipient. Discharge plans are also sent to the family doctor so they can be kept informed about the hospital care and any needed follow-ups. To help navigate these and similar caregiver resources, visit the East Toronto Health Partners Service Directory. The link can be found in the description box below this video. For more information on navigating the healthcare system for your care recipient, watch our other navigation guide videos.